One of the main requests patients coming in for breast implant surgery is to have a beautiful cleavage line. And I know as a surgeon that all of the after photos in breast implant surgery that are the ones that patients like looking at the most and use as their inspiration shots are the ones where there are beautiful cleavage lines. And that typically means that the breasts are relatively close together and there's a lovely fullness towards the middle of the chest. Now, unfortunately, not all patients will be able to achieve that. And this is typically based on the way that their anatomy is. And there's something we as surgeons call the breast footprint, which kind of dictates where your breasts are and where we can operate within. Now, this breast footprint is something that as a surgeon I have to respect, because if you start operating outside of the breast footprint, then it can cause the implant to move into areas where it shouldn't, and as a consequence the breast can start looking deformed when patients lie down or in certain other positions. Now, is there anything that I as a surgeon can do without necessarily disrespecting the breast footprint, but help to improve the cleavage line? And the answer to that is yes. So firstly, if the patient's anatomy allows and I can place the implant above the muscle, then we can dissect the breast gland to an extent where we can bring the implants a little bit closer together, and that can really help to improve the cleavage lines. Now, faced with a situation where that's not possible, then we have to look at other things. And one of the concepts that I use in my practice is that of using an internal bra suture, which puts sutures in a certain position within the breast that it pushes the implant more towards the midline. And if this is used in conjunction with fat grafting, where we take fat from either the thighs or the abdomen or the flanks and then place that on the middle aspect of the chest, then this can certainly help improve the appearance of the cleavage lines. I can't say that this is going to work for everybody, but certainly it does help to improve matters for a lot of patients whose main goals is to improve the cleavage lines in addition to having the increase in volume for the breast surgery.